Hi, my name is Jordan. I'm Dr. Tal's nurse, and today we're going to be going over your pre-op instructions. So we are going to be going over the breast instructions for surgery. So I'm going to start with the medications you'll be prescribed. We're going to prescribe these medications to you when you come into the office in person, and we're going to prescribe them to a pharmacy that's very close to our office, and you'll be able to pick them up right after the pre-op is over. The first medication is an antibiotic. It's called Keflex. It's the only medication that you actually have to take after the surgery. This is to prevent any infection after the surgery. You're going to start this at about 10 p.m. the night that you get surgery, and then it's every 8 hours around the clock until it's gone for 5 days. Now, if you're getting a scaffold or Durezorb, the internal bra, this antibiotic is actually for a week, but if you're not getting that and it's just any other breast surgery, this antibiotic is for 5 days. Now, if you have any allergies, which we'll go over in person, to penicillins, you'll be getting doxycycline, which is every 12 hours instead of every 8. But again, we'll go over this when you come in person. The second medication is Vicodin. It's a pain medication. It's very strong. You only take this medication if you really need it. It doesn't have great side effects. It can make you nauseous, dizzy, constipated. So if you don't have a lot of pain and you don't need it, you'll be taking extra strength or regular Tylenol. That is the only other thing that you can take for pain. No Advil, Aleve, Motrin, aspirins, anything like that. And you can't take the Tylenol and the Vicodin together. The Vicodin is every 6 to 8 hours as needed. You need to eat something before you take it so it doesn't upset your stomach. There will be 18 total Vicodin, but you do not need to take all 18. It's just the most that we can call, so we just do it in case you need it. Vicodin is a narcotic, so it only takes 2 to 3 days to become addicted to it. I just have to make you aware of that so you know. And the next medication is something called Narcan. It's just a law in the state of Florida that anytime I prescribe the Vicodin, I need to prescribe the Narcan. I've never had a patient need to use it. It's just used in case of an accidental overdose of the Vicodin. It's a nasal spray. Somebody else has to do it for you, and they have to call 911 anyway. Again, it's not meant to scare you. It's just a law in the state that I have to prescribe it together with the Vicodin. And then the last medication that we prescribe is something called Zofran. It's an anti-nausea. It's just 2 pills. If you're nauseous from the anesthesia. If you are going to be nauseous, it tends to only last 12 to 24 hours. So there's just 2 pills. If you're not nauseous, same as the pain medication, you just get rid of it. Now, when you go to the pharmacy to pick these medications up, they're going to be in a bag that's stapled closed. Before you walk out of the pharmacy, you'll just open the bag and make sure that they're all in there and make sure that you have everything that you need for after the surgery. Now, aside from those medications, the only other things that you can take unless we discussed something otherwise is vitamin C, 1,000 milligrams a day, and Tylenol if you need it for any reason before or after the surgery. You can also take arnica for bruising and swelling, but other than that, you need to check with our office about anything else. You also want to avoid any herbal teas or herbal supplements, and then 1 week before, no caffeine and no alcohol. If you drink a lot of caffeine, you want to try to kind of taper down off of it, so by the time you get to 1 week, you're having nothing. You will also need to make sure from here until we tell you otherwise that you don't do anything that could cause an infection. This includes things like manicure, dentist, facial, lasers, anything like that you'll need to avoid before surgery and after. Our office will tell you when you can resume anything that we had you stop and when. Nail polish, you'll need to remove any nail polish from your fingers before the surgery. Just don't cut your cuticles or push back your cuticles or anything that could cause an infection, but you can't have any polish on your fingers for surgery because that's how they track your oxygen. Toes, you can have polish. You will need to remove all of your jewelry and all of your piercings before going to the surgery center. This is very important. Leave everything at home. You cannot have any jewelry or piercings on. The night before surgery, no food or water past 10 p.m. You brush your teeth in the morning, but that's it. The night before and the morning of, you're going to take a shower and wash really well with antibacterial soap. Don't apply any lotions, perfumes, deodorant, and try not to shave your armpits for a couple days before the surgery because it's very close to where the surgery will be, and you don't want anything that will cause an infection. To surgery, you wear something very comfortable, sweatshirt with a zipper in the front or a button up, and then bottoms and shoes that are easy to take on and off. Nothing you have to raise your arms above your head to put on, and nothing you have to bend over and struggle to pull up, just loose, comfortable clothes. If you wear contacts, wear glasses, not contact. If you have your period, wear a pad, not a tampon. Somebody needs to pick you up from the surgery center. They will not release you alone, and somebody needs to be with you for at least 48 hours. It's recommended for longer, closer to a week, but at the very least 48 hours, somebody needs to be with you, and somebody needs to come with you to your first follow-up appointment. You cannot come alone to the first one. By the second one, you're usually okay to come alone. You can't drive for at least 1 week, and when the week comes, you don't want to drive very far distances. It's very important after the surgery that you are not crossing your legs at all and you're moving your feet around as if they're on a gas pedal just to help circulate the blood. You don't really want to go out and go outside, go for a walk, but you can walk in the house, like from the kitchen to the bathroom. You don't just want to lay in bed after the surgery for a week. You want to circulate the blood and just make sure you're moving around. For the first week, you'll keep your arms close to your sides like this. You can move your arms here, and you want to move your shoulders around so you don't get stiff or stuck, but you can't move your arms from your sides more than a couple of inches for the first week. You also can't pick up anything heavier than a glass of water. So you can feed yourself, brush your teeth, but no heavy lifting or anything until we tell you otherwise. For the first week, you'll sleep in a reclined position, a couple pillows behind your back, couch, recliner, whatever's most comfortable for you, but you can't sleep flat until 1 week. And then for the first week, you can't actually get into the shower, so you'll use a washcloth, baby wipe, wash your lower body, you can wash your armpits, but you can't get into the shower until 1 week. Exactly 1 week from the surgery, you can bring your arms to shoulder level, sleep flat on your back, and take a full shower. 2 weeks from the surgery, you can bring your arms above your head. You can start to use a scar cream on your incisions, and you'll switch to an underwire bra. So you were sent a link to Dr. Tal's Amazon account. It has a bunch of different pre and post-op recommendations on there. There are different sections with the different bras. So you're going to come out of surgery with dressings and an A-strap wrapped around. You'll leave that on. We'll take it off on your first follow-up, make sure everything looks good, wrap you back up, send you home, and then 1 week from the surgery, you take it off, you throw it in the garbage, and you take a shower. At that time, you'll just wear something very loose and comfortable, something with no padding, something with no underwire. There is a section on Dr. Tal's Amazon that says bras to wear 1 week from the surgery. There's a bunch of different options, most of them snap or zip in the front. You'll wear that after you take a shower at 1 week for 1 week, and then at the 2 week mark, you switch to an underwire bra. There's another section on Dr. Tal's Amazon that says bras to wear 2 weeks from the surgery. They all have underwires. The underwires are very padded. I always recommend order a couple different sizes, keep the tags on, and then whichever one fits you keep, and you return the rest. So you have one at that time that fits. The other thing on the Amazon that you'll have to order before the surgery is something called an incentive spirometer. This will help expand your lungs after being under general anesthesia. Order it sometime before the surgery so you have it when you get home. You'll use it for about a week, 10 days, and then you just get rid of it. Anything else on the Amazon account will guide you and tell you if you should get it. Regarding the blood work and everything we had you do, there is a pregnancy test in the blood work. So between when you have the blood work done and until we tell you otherwise, you cannot have any sex. You do not want to get pregnant or a UTI or a yeast infection or anything that will lead to canceling your surgery. If you have any questions, just call our office or email me. I have my email here. And we look forward to having you for your in-person pre-op and for your upcoming surgery.